Live from ABC 7, this is Eyewitness News in high definition.
If breast cancer is caught early, doctors usually treat it with surgery and radiation. But radiation alone is often spread out over a 2-month period, and it involves the whole breast. Now doctors say the SAVI procedure may help some women get back to their normal lives within days versus weeks.
Yeah, we had fun. We actually...
Many breast cancer patients receive about 6 weeks in radiation after surgery, so they get to know their doctors well. But 81-year-old Carolyn Daniels didn't have to spend a lot of time in a doctor's office.
And it sounded good to me to have it over with in a week.
In January, Carolyn had a mammogram which showed a tumor in its early stages. When Dr. Jeannie Shen removed it, she found the cancer had not spread. That made Carolyn a good candidate for the SAVI, which stands for Strut-Adjusted Volume Implant. SAVI cuts down the amount of time a patient undergoes radiation, from 6 weeks to 5 days. And through a series of catheters, it targets just the area right around the tumor.
And the catheter is simply inserted through that into the lumpectomy cavity, and then the catheter is expanded.
Carolyn says she didn't feel any discomfort throughout the treatment. She went in 2 times a day. The catheter's wires are connected to a powerful radiation source. But Carolyn didn't feel a thing. The only discomfort, removing the catheter at the end of the week.
But it was just momentary, and it wasn't a big deal.
Besides saving patients a lot of time, this 5-day treatment has other short-term advantages, including no skin burning and less fatigue. And doctors say the other big advantage, you can actually sculpt and tailor your radiation treatment.
If the dose to the skin is high, then we have the physicist move the source away from the skin.
Only about 1 to 2% of patients experience a recurrence. However, chances of infection are a little higher. Most importantly, the earlier a cancer is caught, the more treatment options a woman has.
When they meet with their breast surgeon or their radiation oncologist, ask. It never hurts to ask.
Again, the SAVI procedure isn't appropriate for all breast cancer patients. It's only offered to women who are diagnosed at the earliest stages. Carolyn said she went back to swimming in about 2 weeks after her SAVI radiation treatment.